Hello everyone, hope you all are doing fine. This is Gautam from Shailaja IS. Yet another video on your mains current affairs issues from your UPSC civil service examination perspective. In this video, I'll be talking about the 80th Household Consumption Health Survey, which was conducted by your National Statistics Office. They try to understand what are the trends, both positive and negative, with regard to the health expenditure that has been incurred by any households. Through that, you can say survey, we'll try and understand our insurance penetration. We'll try and understand the shortcomings of our public healthcare facilities, and we'll try and understand, or it will give us insights about the dominance or the predominance of your private healthcare facilities in India. Right. So in this video, we'll understand the key highlights of the report, and then we'll look into the positive aspects as well as the negative aspects from the survey highlights. And finally, we'll understand what more reforms needs to be done in the coming years or in the coming decades. The first key highlight is there has been explosion of insurance coverage both in rural India as well as in urban India. Rural coverage has tripled, surging from 12.9% to 45%, primarily because of government schemes like Pradhan Mantri Jan Arogya Yojana or Ayushman Bharat Yojana. Right? Your Ayushman Bharat Yojana has basically two important pillars. Okay? Ayushman Bharat. It is basically having two important pillars. One is your health and wellness centers. Health and wellness centers. Nowadays it is called as Ayushman Arogya Mandir. Ayushman Arogya Mandir. The second aspect is your insurance, which is Pradhan Mantri Jan Arogya Yojana, where it provides insurance up to 5 lakhs per family per year. And this insurance scheme is covering 55 crore people in India. These are some of the key highlights of Ayushman Bharat Yojana. It is an overarching umbrella scheme under which primarily two components. One is your health and wellness schemes, health and wellness centers. Nowadays it is renamed after 2022 as Ayushman Arogya Mandir, primarily focusing on your primary care. The second pillar is your insurance under Pradhan Mantri Jan Arogya Yojana, which provides 5 lakhs per family per year for your secondary and tertiary care, and it covers 55 crore people in our country. Right? So one of the important progress that India has achieved with regard to insurance coverage is that it has nearly tripled over the last decade, right? And primarily because of your Pradhan Mantri Jan Arogya Yojana. Right? Urban insurance coverage has also increased significantly from around 9% to 32%. So on an average, if you look at a pan-India level, insurance coverage now stands at around 38 to 40%. This is one of the important data points. This is one of the important achievements of India's healthcare system. Right? So that you make a note of it. Next, out-of-pocket expenditure. Like rather than you going to a public hospital, if you go as an outpatient care, like you just want to understand what is wrong with you or you want to get some medicines, you're not going to get hospitalized. Hospitalized means you're going to book a bed, you're going to stay there for 1 or 2 nights or 3 or 4 nights, depending upon your situation. Outpatient care is something you just go for the doctor consultation, who analyzes or you diagnoses your situation, prescribes medicines, go and get medicines in that particular, you can say public hospital, or go and get certain tests from your public hospital and come out. So that outpatient care costs have come down to zero. So if you go to any public hospitals, you can go and get diagnosed, you can go and get consulted, you can go and get free medicines, free tests in your public hospitals. If you go to private hospitals, you have to first pay registration fees, you have to pay doctor consultation fees, which in a city like Bangalore costs around 600 to 700 rupees per consultation. Yeah, if at all they are asking you to get blood test, X-ray, scanning, you have to again pay for that again 800 to 1000 rupees. Medicines they are going to prescribe, again you have to pay for the medicines, that will be around 500 600 rupees. If you go to a private hospital for an outpatient care, outpatient consultation, in a metro city like Bangalore, it is costing anywhere between 1000 to 2000 rupees. But when you access your public health facilities, it is zero. Okay, and that has been proved by your Household Consumption Expenditure Health Survey by your National Statistics Office. But even otherwise, sometimes you might have to, even after covering all the insurance and so on and so forth, you still have to pay from your pocket. That is called as your out-of-pocket expenditure. In India, on an average, out-of-pocket expenditure is around 11,285 rupees per year per person. Now, what does that mean? It means that, for example, if I as an individual, on an average, they have understood that I will be spending around 11,500 rupees, approximately 1,000 rupees every month on your healthcare expenses. Right? It might be getting consultation, it might be getting testing, it might be getting medicine, so on and so forth, from my pocket, not from the government. Government is incurring a separate healthcare cost. From my own pocket, in spite of availing all the facilities, I might be incurring on an average 11,285 rupees per year on your health expenses. But if you take away the private expenditure part of it, and if you just look into the median or the average expenditure on the public hospitals, suppose you are getting admitted to a public hospital, for example, for your cataract surgery, or for some minor surgeries like your what is that? Any minor bone repair surgeries or whatever it is, you might have to get hospitalized. Even insurance is going to be covering your expenses. You might have to still pay something out of the pocket. If you consider only the public hospitals out-of-pocket expenditure, it is around 1,100 rupees. But if you include the entire country, the public and private out-of-pocket expenditure, the average is coming around 11,285 rupees. So keep a note of this. Primarily, it is driven by heavy dependence on the private sector. Okay. Next important aspect, ailment reporting. So whatever diseases you're having, you're going to go and report it in your hospitals, both either private or public. That has increased to a considerable level. Ailment reporting has nearly doubled from 6.8% to 12.82% in rural areas, and from 9% to almost 15% in urban centers. For example, if a person is suffering from diabetes, generally they don't go and report it, they don't go and consult a doctor in a government hospital or a private hospital. Large sections of society feel that it is natural and they'll somehow manage it or they'll just somehow push it. Even if they are having some cough, even if they are having some injuries or whatever is the diseases, the reporting itself is at a lower level in India, primarily because we have basically having our own dependence on your traditional medicines, Ayurvedic medicines. You're having suspicion or mistrust on reporting it to the hospitals because you feel that there will be again expenditure from your pocket. So reporting itself is at a lower level, but what we have seen in the recent years is that it has been increasing in a good number. So there has been increase in ailment reporting from around 6% to 12% in rural areas, and from 9% to 15% in your urban centers. See, the data itself is not important for us from an exam perspective. What is important for us is that analysis from this particular data. What it is clearly showing, that people are increasingly aware about their health and they want to get it tested and they want to detect any diseases in an early manner and they want to rectify or get the medicines at the early stages itself, rather than maybe delaying it and waiting for the right time. No. Nowadays, people are health conscious, accessibility is high, insurance coverage is also in a good number, awareness is high. So people immediately go, report it, and try and get it tested or screened, diagnosed, and get the medicines if at all there is any problem. So that is clearly indicating the population is now becoming increasingly health aware in our country. Okay, so that is the big takeaway from this particular slide. Okay, the data is not really important. What is important is the rising health awareness in our society. Okay, for the previous slide, you please make note of the data. It becomes useful for you whenever you are writing your answers. See, this entire report, they may not ask you straightforward, give me the highlights of the report. They'll ask you about the broader healthcare structure in our country and what are the administrative problems we are facing. So in your analysis, you can give all these data points as your supporting value addition points to the argument that you are going to make. Right? If you are making that there is high out-of-pocket expenditure, so if at all any major disease is diagnosed by a breadwinner of a family, there is high chances that the person will go into poverty, because there is increasing dependence on your private sector, right? And high out-of-pocket expenditure. Okay, so these data points become important from a value addition perspective, right? So the next part, disease burden is shifting. Infectious diseases like malaria, tuberculosis, that incidence is reducing. Why? Because people are increasingly getting tested, people are increasingly aware, they're increasingly reporting their diseases to the public or private hospitals, and they're getting it screened and getting it diagnosed early. So infectious diseases burden is slowly coming down, but non-communicable diseases like hypertension, diabetes, this cardiovascular diseases, this instances is growing. This is clearly indicating that lifestyle diseases is increasing. So we might have to change our entire health paradigm to understand and try to solve this particular risk or this particular trend. And that is why you have Fit India campaign, which was started by Narendra Modi ji, where he pushes people to, you can say, be fit and try to beat all this or try to overcome all this lifestyle diseases, right? Next important highlight of the report is nearly 60% of the rural hospitalization or 65% of the urban hospitalization still occur in private medical facilities. Hospitalization, as I told you, is where you are getting admitted in like 1 night, 2 nights, 3 nights, 4 nights for whatever other surgeries or for whatever other diagnosis. For example, dialysis, you can get it done maybe in 3 hours or 4 hours time. So it does not require hospitalization. But if there is a institutional delivery, if a mother is giving birth, she might have to get admitted for 1 or 2 nights. Likewise, if there is a surgery, okay, maybe a bypass surgery for your heart, or maybe a cataract. Cataract is also nowadays doing within the day. Any other surgeries, any other major surgeries, then you might have to get hospitalized. And the survey has really pointed out, people prefer to get hospitalized in private medical facilities rather than in government medical facilities. Because of trust, because of credibility. Even if it is costing more, they have identified that the private hospitalization is nearly 7 times costlier than the public hospitalization. Right? For example, if there is an appendicitis and you have an option of getting it operated at a public or a government hospital, and you also have an option of getting it operated in a private medical facility, the chances are that you get it operated in your private medical facilities. That is what the data is showing. Nearly 60% in rural areas and 65% in urban areas are undergoing hospitalization in your private medical facilities. Okay, so you prefer to get your appendicitis operated in your private medical facility, primarily because of the trust factor, hygiene factor. Even if it is costing 7 times more, even if it is costing 7 times more than your public hospital, you still prefer to spend from your pocket and get it operated in a private medical facility. right? So that is one of the important key highlights from the survey, right? Another important positive aspect is we have achieved near universal institutional child deliveries. Earlier, if there is any pregnant woman who's giving birth, see your mother or grandmother, if you ask from them, they would have given birth not in an hospital, but in their own homes, right? Because at that point of time, there were people in the villages called as midwives who used to handle all these deliveries. And it may have been safe, it may have been unsafe also. But slowly, the country and the administration understood that it is safer for women to give birth in institutions, in hospitals, and prevent, you can say, infant mortality. Because they understood that if a woman is giving birth in an unsafe conditions, there is high chances that the baby will not survive. So in order to tackle this mortality, in order to tackle this infant mortality, they started pushing women to give birth in institutions, in hospitals, be it either government hospital or in private hospital. So that mission was undertaken, Janani Suraksha Yojana, in UPA government era itself. So for nearly 2 decades, the government has been creating awareness about the safety of giving birth in institutions, that is in government or private hospitals. And we have seen increased, and we have seen that people have accepted it. And now if any woman is giving birth in their home, generally the instances are very rare. Okay, so almost 96% in rural areas and 98% in urban areas, the deliveries are happening in your either government or private hospital. In case of rural areas, nearly 2/3 of the deliveries are happening in your government hospital, 1/3 is in private hospital. Okay, so this is one of the significant achievements of our Ministry of Women and Child Development, because the Janani Suraksha Yojana, which was started by UPA government, that is your Manmohan Singh government, one of the primary objective is to increase the institutional deliveries. The objective is to make the delivery more safer. Objective is to control infant mortality, and that has yielded results. Okay, so it is not like our government is not doing anything. Our government has been in mission mode and is trying to address some of the real core issues that is happening at the ground level, right? So this is one of the key highlights of the report. Now, if you look at the overall positive trends, you can clearly see there is increased insurance coverage, there is increased health awareness because of increased ailment reporting, and there are affordable public care, because you see that outpatient care cost in public hospitals is 0, and there are safer births right now, right? So, and another important positive trend is that there has been a proactive screening measures which is driven by greater health awareness. Okay, so these are some of the positive trends that we can decode from this survey highlights. Okay, so what all, so that is very important for us. What is failing, or what are the challenges that are still existing in India's healthcare system? See, there is still a heavy reliance on your private sector. As I already told you, for any hospitalization, nearly 2/3 of the population depend on your private medical facilities. So there is heavy reliance on private sector. There is lack of trust on your government facilities. So government needs to increase the quality of the public healthcare infrastructure, so that people have the trust in getting the necessary services from the government hospitals. Okay, like if you are in metropolitan area, most of you who are watching this video are from your middle class families. How often have you gone to a government hospital to get any treatment? I think very, very less. We don't even think about going and getting diagnosed in a government hospital. One is because of the time aspect, because there is going to be a lot of crowd. Second is also because of the quality aspect, and there is no assurance with regard to the quality. So even if we want to borrow money from someone, we'll try to borrow it and get the necessary healthcare services from a private hospital. So that is a scenario in India, and that is one of the challenges that continue to haunt India's public healthcare infrastructure. Right? The credibility of government hospitals is still not to a good level, right? Second, there is a heavy cost disparity. Your private hospitals are nearly 7 times costlier than your government hospitals. So people who are wealthier, people who have resources, people who have good income are able to get access to private healthcare. But what about people who are living below poverty line? What about people whose income is very meager? For them, they are at a much more riskier position, right? Also, another important concern or the challenge is the rise of non-communicable diseases. As I already told you, like cardiovascular diseases, diabetes, hypertension, all these are increasingly seen across people, right? So the government has to reshape its policies to address this trend of rising communicable diseases, right? And another important, you can say, challenge is the regional diversity or regional disparity that continues. You have your eastern and northern parts of India who are still lagging behind in your healthcare infrastructure and healthcare services as compared to your southern and western states. Your Kerala is having a very robust primary healthcare infrastructure as compared to Bihar or UP or Jharkhand or Odisha. Okay, so that regional disparity has to be addressed by the union government, right? So these are some of the challenges that continues to haunt our India's healthcare sector. Now, what are the reform priorities? First and foremost thing, as I told you earlier, we have to strengthen our public healthcare infrastructure by increasing funds into it. Second is that we have to be conscious about the rising trend of non-communicable diseases and align our policies to tackle that. Third is that there are large sections of people who are neither in the bracket of Pradhan Mantri Jan Arogya Yojana nor they are having private insurance. So there are nearly 40 crore people who are neither in government insurance bracket nor in private insurance bracket. So they needs to be brought in or they needs to be pushed into the insurance coverage, right? Fourth is the percentage of elderly population is going to increase in the coming decades. By 2050, it is estimated around 20 to 25% of the population are going to be persons who are aged 60 years and above. So their healthcare burden is going to increase. Therefore, our public health infrastructure also has to realign to address the unique needs of aged population. Okay, because obviously their ailments, their reporting are also going to increase. The disease burden is going to increase for people who are aged 60 and above. So our healthcare facilities needs to be big enough to absorb the growing demand of this aged population, right? Another important aspect is insurance right now is limited at 5 lakh per family per year. But if there are any severe cases like cancer, where we have seen increasing instances of cancer amongst the population, which is much more expensive, government has to bring in certain measures in order to deal with more severe cases like cancer or other surgeries. Okay. Finally, workforce. There is a shortage of medical workforce in our country. As per World Health Organization standards, there has to be 1 per 1,000. Okay, there has to be 1 per 1,000, 1 doctor per 1,000 population. But right now, we are having around 0.83. Okay, or in other words, if you want to extrapolate it, there has to be 1,000 doctors for 1 lakh population. But in India, we are having around 834 people. Okay, so that there has to be increase in medical workforce as well. So you need to open more and more medical colleges. You need to make medical education more and more accessible. And you need to make sure that the medical education curriculum is addressing the changing trends of the Indian society, be it with regard to rise in non-communicable diseases, be it with regard to the increased disease burden from your aged population, right? Obviously, there are, you can say, other concerns as well. For example, other reforms that they need to take care is your diagnostics. Right now, diagnostics industry in India is not fully developed, is not indigenously developed. It is still dependent on other countries for expensive and modern medical equipments. So country as a whole, or the government specifically, has to make sure that it pushes for indigenous diagnostic industry in India, right? Obviously, another important aspect is increased state funding, which I already mentioned. States has to be incentivized to strengthen public infrastructure. Okay, mental health care also needs to become an important pillar of any healthcare policies. Okay, so these are some of the reform areas that the government has to focus in the coming years. I hope you got a brief idea about this entire topic, the key highlights, positive trends, the challenges, and the reforms that is required, or the way ahead for India's healthcare policies, or the way ahead for India's healthcare reforms. Now let us look into one small question. The NSO survey reveals that while the poor have nominal health coverage, the middle class faces rising cost. Do you think India's healthcare reform strategy has been too focused on insurance and too little on building public hospital capacity? Justify with evidence. So they're just asking, if we take the route of providing insurance coverage, how effective it is to address the concerns of the society. So you have to give the positives and negatives of the insurance coverage as an approach of public health policy versus strengthening your public healthcare infrastructure. Yeah, pumping in more funds, building more hospitals, recruiting more doctors, increasing the bed strength, increasing multi-speciality hospitals. That is one route. Second route is whereby government provides you insurance coverage, and hospitals are going to be empaneled. You go and get a treatment in any hospital, and the insurance is going to take care of it, and the insurance premium will be taken care by the government itself. That is your USA model. UK model is whereby you pump in money to build actual public hospitals, actual government hospitals, maintain high standards, get good equipments, hire good doctors, pay them good salaries. That is your UK model. Okay, the UK model is much more time consuming in its nature. US model is quick. You can quickly enroll people, you can quickly give them insurance coverage. So they're asking you the positives and negatives of both these models in this question. Right? If you're able to attempt it, and if you want to get a feedback, please send it to me on my WhatsApp or Telegram on this number, or you can email it to me on this email address. So looking forward for your feedback, looking forward for your answers. If you have any doubts, feel free to contact me.